Do you know the difference between a common allergy and a life-threatening one? Anaphylaxis is a severe allergic reaction that can strike suddenly and progress rapidly. Understanding this condition is crucial for your safety and the safety of those around you. Anaphylaxis is a serious, potentially life-threatening allergic reaction. While many people associate it primarily with food allergies, it can be triggered by various substances. Insect stings, medications, and even latex are common culprits. Most allergic reactions are mild, causing symptoms like watery eyes or a runny nose. However, exposure to an allergen can sometimes lead to this severe, systemic response. It's vital to recognize that anaphylaxis is a medical emergency requiring immediate attention. Anaphylaxis is relatively rare, but its severity is highly unpredictable. Even if you've only experienced mild allergic reactions in the past, you could still be at risk for a severe anaphylactic episode. Past reactions do not guarantee future ones will be similar. Future reactions can be milder or significantly more severe than previous ones. This inherent uncertainty underscores the importance of preparedness. A second reaction, known as a biphasic reaction, can also occur hours after the initial event, sometimes up to 24 hours later. Anaphylaxis symptoms appear suddenly and can worsen very quickly. Early signs might seem mild, such as a runny nose, a skin rash, or even just a strange feeling. These initial indicators should never be ignored. These mild symptoms can rapidly escalate into more serious, life-threatening problems. It's essential to be aware of the full spectrum of potential signs. Prompt recognition is key to effective intervention and better outcomes. Severe symptoms include trouble breathing, hives, or widespread swelling. You might also experience tightness in the throat or a hoarse voice. Gastrointestinal issues like nausea, vomiting, abdominal pain, and diarrhea are also common. Other critical signs involve dizziness, fainting, or a sudden drop in blood pressure. A rapid heartbeat, a feeling of impending doom, or even cardiac arrest can occur. Any combination of these symptoms warrants immediate emergency action. Certain individuals face a higher risk of experiencing anaphylaxis. If you have a history of allergies, especially severe reactions, you are more susceptible. People with asthma also have an increased risk. An allergist is a medical specialist who can assess your individual risk. They can review your medical history and conduct specific tests. This evaluation helps determine your susceptibility and identify potential triggers. Allergists are doctors specifically trained to manage allergic conditions. They play a crucial role in diagnosing triggers and developing personalized treatment plans. Consulting an allergist is a proactive step towards managing your allergies effectively. They will meticulously review your history of allergic reactions. This includes conducting various diagnostic tests, such as skin prick tests, blood tests, and controlled challenges. These tests help pinpoint your specific allergic triggers. An allergist will also discuss various treatment options tailored to your needs. They can educate you on the best methods for avoiding your allergens. This comprehensive approach empowers you to live more safely and confidently. You should talk with an allergist if you are unsure whether you've had an anaphylactic reaction. Seek their expertise if your symptoms occur repeatedly or are difficult to control. They can perform additional tests to determine the exact cause of your reactions. An allergist can also advise if desensitization or immunotherapy might be beneficial for you. If daily medication is required to manage your allergies, their guidance is invaluable. Furthermore, they can help navigate treatment complexities if other medical conditions are present. Anaphylactic reactions demand immediate treatment with epinephrine, also known as adrenaline. This medication is available by prescription and comes in autoinjectors or a nasal spray. It should always be kept readily accessible. Epinephrine works by rapidly reversing the severe symptoms of anaphylaxis. It helps open airways, raise blood pressure, and reduce swelling. 2 doses of epinephrine may be necessary to control symptoms effectively. Identifying your specific triggers is the first critical step in preventing future anaphylactic reactions. An allergist can help you uncover what causes your severe responses. They will review your medical history and conduct necessary diagnostic tests. The most common triggers include certain foods, which are a leading cause of anaphylaxis. Peanuts, tree nuts like cashews and pistachios, fish, and shellfish are frequent culprits. Dairy products such as cow's milk, eggs, and sesame are also common food allergens. Latex is another significant trigger, found in many everyday products. This includes disposable gloves, intravenous tubes, syringes, and adhesive tapes. Healthcare workers, children with spina bifida, and those with certain genitourinary abnormalities are at higher risk for latex-induced anaphylaxis. Fortunately, the incidence of latex allergy has decreased over time. This is largely due to the reduced use of natural latex in many products. However, awareness remains crucial for those still at risk. Medications can also induce anaphylaxis. Penicillin and other antibiotics are common pharmaceutical triggers. Aspirin and nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen can also cause severe reactions. Medications used for anesthesia are another potential source. Insect stings are a well-known cause of anaphylaxis. Bees, wasps, hornets, and yellow jackets are among the most common stinging insects. Fire ants, particularly in certain regions, can also trigger severe allergic responses. Avoidance is the most effective strategy to prevent anaphylaxis. An allergist can help you develop a personalized avoidance plan. This plan considers your age, activities, occupation, hobbies, home environment, and access to medical care. For food allergies, meticulously review all ingredient labels on packaged foods. This helps uncover any potential allergens hidden within products. When dining out, always inform your server about your allergies and ask detailed questions about ingredients. If you have a child with a history of anaphylaxis, provide school personnel with a comprehensive treatment plan. This plan should clearly specify their allergies and outline the exact steps to take during an allergic reaction. Clear communication is paramount for their safety. For medication allergies, ensure all your doctors are aware of any past reactions. This allows them to prescribe safe alternatives and inform you about other medications to avoid. If no alternatives exist, desensitization might be an option. Desensitization involves introducing small, increasing doses of the medication you are allergic to. Your body gradually becomes more tolerant over time. While effective, this treatment is not permanent and must be repeated if the medication is needed again. To prevent insect stings, avoid walking barefoot in grassy areas. Refrain from wearing bright-colored clothing with flowery patterns during active insect seasons. Sweet-smelling perfumes, hairsprays, and lotions can also attract stinging insects. An allergist can offer venom immunotherapy, or venom allergy shots, for insect sting allergies. This preventative treatment introduces gradually increasing doses of purified insect venom. It has proven highly effective, preventing future reactions in 90% to 98% of cases. Prompt recognition of anaphylaxis signs and symptoms is absolutely critical. If you unexpectedly encounter your trigger, immediately follow the emergency plan outlined by your doctor. Time is of the essence in these situations. If you are having a reaction and are unsure whether to use epinephrine, it is always better to administer it. The risks of using epinephrine unnecessarily are far lower than the risks of delaying treatment for anaphylaxis. Always keep your epinephrine up to date. However, if an expired epinephrine product is the only one available in an emergency, administer it promptly anyway. Some potency may be lost, but it is still better than no treatment. Teachers and other caregivers must be informed about children at risk for anaphylaxis. They should also know precisely what to do in an allergy emergency. If you administer epinephrine and do not start improving within minutes, seek emergency medical care immediately. If symptoms worsen, administer a second dose of epinephrine as prescribed. Inform your family and friends about your condition, triggers, and how to recognize anaphylactic symptoms. Ensure they know where you keep your epinephrine and how to use it correctly. Their knowledge can be life-saving in an emergency. Some individuals at risk for anaphylaxis choose to wear medical jewelry. This jewelry alerts others to their allergies and the need for epinephrine in case of a severe reaction. It provides crucial information to first responders. Anaphylaxis is a serious condition, but with proper knowledge and preparation, it can be managed effectively. Don't let the fear of a reaction control your life. Take proactive steps to understand your risks and triggers. Consult an allergist today to gain control over your symptoms. They are uniquely trained to help you navigate your allergies, conduct necessary tests, and review all available treatment options. Empower yourself with knowledge and a plan. Visit your allergist, understand your triggers, and always carry your epinephrine. Share this vital information with your loved ones. Take charge of your health and live the life you want, safely and confidently.